And welcome to another version of Beyond the Script. I know it's been a few days since I've gone online and shared some thoughts with you, but I've been very busy for the last couple of weeks, really. And the last few days, we've had some patients that's presented some challenge in managing. So I decided to give you some insight as to what we've been dealing with from the clinical side of things. So I'm going to talk about what's been going on at Montgomery Heart Wellness in the office. Of course, I won't talk about any specific patient cases, but I'm going to give you an overview of some of the clinical conditions that we've been faced with in the last few days. And part of my mission here with Beyond the Script is to give you lots of insight. And very few shows give you day-to-day insight into, health conditions, the type of illnesses that a physician deals with on a day-to-day basis. We'll not only do that, but we'll tell you exactly how we integrate the nutritional regimen in that setting. And I think it's going to be very helpful to give you insight. We also, over time, will interview patients. And so you'll get a chance to meet some of our patients who will give consent to share, some insight into their journey. But what I want to talk about today, first and foremost, are some of the issues we dealt with. And heart failure is the key topic that I want to talk about. We've had a number of patients we've been managing with heart failure. Of course, we manage patients with heart failure all the time. But the reason I'm raising it now is because there were some particular issues that we've been dealing with and some fairly unique issues. Let me just first talk about congestive heart failure. And there is, a talk I've done on heart failure before. It's going to be on our YouTube channel, so stay on the lookout for it. It's a lecture. It's going to be more comprehensive than what I'll give you here. But just to give you an insight into congestive heart failure and what that means, congestive heart failure is, by definition, is a situation in which the heart is not able to contribute blood flow to the body commensurate to the body's needs. So the heart is not able to fulfill the body's needs in terms of flow. So the kidneys, the legs, the GI tract, the brain for that matter, may not get adequate blood flow at a given period of time. Now, the body has a unique way of compensating. And so, you can have the early phases of heart failure where at the very first moment, the heart's not able to deliver oxygen to different tissues according to their needs. The body has a way of compensating. So you may not feel these symptoms right away. So early on in heart failure, and the term heart failure is a little bit misleading in a way because it implies that the heart fails. It completely, sort of like your tires on flat, it's not going to function anymore. But heart failure is not exactly when the heart just goes kaput. It's when the heart is not able to meet its demands. And so by definition, it doesn't meet its demands. We call it heart failure. There are different forms of heart failure. I'll talk about that in a minute. But so at the point where the heart begins to not be able to meet its demands, the body compensates. So, when you're not able to get enough tissue to the GI tract, there's some level of compensation. To the kidneys, some level of compensation. So you may not have symptoms, right away. The body has certain hormones that it can produce to increase blood pressure. It can create hormones to shunt blood flow from one area to the other, and so on and so forth. Certain tissue can hibernate, if you will. The heart itself can hibernate meaning that it decreases its metabolic demands so that the demands are not as high. So, for instance, if the heart is only to give a certain amount of flow per unit time to tissue bed A, then tissue bed A will then turn down its metabolism and slow things down so that it can make do with the amount of heart flow that it can get. And so there are different ways of compensating. And so early on, when someone has a heart condition, quote unquote, or heart failure, they may not feel symptoms at all, and they may function at a normal rate. And then over time, the heart may get larger and weaker because these compensatory mechanisms may not be beneficial to the heart itself. For instance, if the kidney's not getting adequate blood flow, the kidney may secrete hormones that may increase blood pressure, increase resistance of flow in the arteries. It may increase hormones that causes retention of fluid, retention of sodium. And these things very early on may not, be noticeable, but over time, as things progress, these things can become more noticeable. So heart failure in of itself is a situation where the heart does not contribute circulation and flow commensurate to the needs. Now, by the time someone comes to see me in my office, oftentimes they have symptomatic heart failure. So they may have had this condition for years or decades, and now it's starting to manifest as symptoms. So we've seen patients recently with heart failure in association with cancer and other metabolic demands. So if you have heart failure, and heart failure by itself is a problem. So when the heart is not able to contribute flow to meet the demands of the body, then that's one problem. However, if you add another factor such as cancer or an infection or even another metabolic problem, i.e. diabetes or liver dysfunction, then you've added something to the overall heart failure. So now you've increased the demand. So cancer, for instance, triggers an enhancement need of the immune system. We talked about the immune system not long ago in reference to COVID-19. The immune system works in many capacities. So if the body has cancer, then the body's immune system is going to have to be revved up. And so that creates a demand on different other organ systems to meet that demand to fight the cancer. So the heart function, flow, oxygen, nutrients that needs to go to different organ systems has to be at its best in order to meet these extra demands. So we've dealt with patients recently with heart failure and cancer. And so while we're trying to treat the heart failure, we're trying to give them nutritional support for the cancer while their cancer doctors are treating the cancer. And so there are many situations where we're having to say, okay, here's what we need to do for the heart, but we have to step back and say, what do we need to do for the overall body's physiology and biochemistry that's going to enhance the overall effect? Another situation we've dealt with recently is patients who've had heart failure and liver dysfunction and kidney dysfunction. Now, just to back up, as I said before, the heart is responsible for circulating flow to different organ systems, to the kidney and also to the liver. So patients who have kidney dysfunction, the kidney dysfunction can also worsen the heart failure, as well as the heart failure worsening liver function. So dealing with patients with bad circulation impairs kidney function, impairs liver function. And so when we're giving patients medications for the heart failure, we give them diuretics, we give them medications called ACE inhibitors, we give them medication called angiotensin receptor blockers, we may give them beta blockers, we may give them, in some cases, quote unquote blood thinners or antiplatelet agents or anticoagulant drugs, because if they have heart failure with coronary disease or if they have an abnormal heart rhythm like atrial fibrillation, we have to anticoagulate them. We may give them a medication called amiodarone to control the abnormal heart rhythm. And we've had some patients recently who've had these conditions. We're treating with these medications. However, these medications also have an impairment on the liver. Go to my section on medication side effects. So when we're treating one condition, but then the patient has heart failure and also some liver dysfunction and kidney dysfunction, then we're between a rock and a hard place, because we have to give a number of medications for the heart condition and the heart rhythm condition, but these medications has an impairment on the liver. If these medications tax the liver to a certain point where the liver is not able to carry out its function, well, what are some of the basic functions of the liver? Well, the liver is a major metabolic machinery, if you will, of the body. When we eat something or we take medications or whatever the case is, they go through our GI tract, they go through what's called first pass, it goes through the liver, it goes through the hepatic, the portal flow and into the liver, and these products are broken down. So foods that we consume, medications that we take orally, all of these go through the liver and are broken down by the liver. So if the liver is not its best, and one way the liver can start to fail with heart failure is you get congestion, because when blood is not flowing up to the heart, to the right side and out, then the blood backs up, it congests, and it goes to the liver and it gets stagnant in the liver, so the liver swells. And the liver gets swollen, sometimes it gets scarred, it becomes inflamed. So the liver can be impaired. So we're prescribing medication to treat the heart, while at the same time these medications are putting extra burden on the liver. And some of these medications put an extra burden on the kidney, which may also be impaired with heart failure. So there we have 3 organ system dysfunctions where we are treating heart failure, but we also have some early signs of kidney dysfunction or failure, and some early signs of liver dysfunction and failure. So there's a catch-22. This is why I like nutrition and nutritional detox so much. When I see a patient like this, one thing I do is I start them on a nutritional detox. What that does is that it helps remove some of the burden on some of the organs. We know from our data, clinical data, and some of our published data, that when someone consumes a raw detox diet, it helps the blood vessels dilate. And when these blood vessels dilate, it decreases the pressure on the heart and allows circulation to improve. So flow through the arteries is improved, and it goes to the different organs. So that's almost an immediate finding that we have. When this happens, flow to the kidney improves, flow from the heart and through the heart improves, less congestion is on the liver. Additionally, what happens with this medication, with this nutritional regimen, it decreases inflammation. So when you decrease inflammation, by decreasing inflammation, it also improves organ function. Some of the dysfunctional aspects of the liver is because the liver becomes congested and inflamed. Decreasing inflammation improves liver function. It improves the ability of the liver to break down these medications and also clean the blood of toxins, which again makes an environment better for the heart. Additionally, what we've shown in our published data is that this nutritional regimen allows us to reduce medication. So I may not have to treat them with as high a dose or as many medications to lower the blood pressure with heart failure, because the blood pressure will go down because the blood vessels are dilated and the flow is improved, pressure comes down. So I can reduce the number of medication, therefore reduce the side effects. So I'm just giving you a little insight as to how a nutritional detox can come into play and help reduce some of the drug-drug interaction, reduce some of the organ dysfunction problems that we have, to give us a little bit of a breather and give us some ability to allow the cardiac situation to improve and the overall physiological and metabolic condition to improve. Now, it doesn't mean that immediately it's going to turn the patient around. Sometimes, these patients require a long integrative therapy. We have some patients we've recently treated who we are managing with raw detox diet. Plus, we have them on special heart medication infusions. These patients will have to get special pacemaker devices that's going to help improve the heart synchronization. So with the nutritional detox diet, it helps us minimize the medication we have to use. It also improves organ function, such as liver function, kidney function, and also heart function. So it allows the recovery of the body's organ systems, while the medications on a temporary basis is sort of keeping the physiology and biochemistry to some extent stable. This allows tissue and organs and organ systems to improve, to recover over time. It allows us to do some of the natural things with the patient. It allows the patient to get out of the hospital, allows them to exercise, get fresh air, allows them to rest better. And as these things take place, the body continues to recover progressively over time. So what happens is, as the body improves, the cardiac function improves, we slowly and progressively dial down the needed medical therapies. We decrease the medication, decrease infusions and the like, and we let the body's natural abilities take place. The heart muscles can improve. Some medication we use, like beta blockers, they can be used temporarily to allow the heart function, the heart muscle rather, or heart tissue, I should say, increase beta receptors. Beta receptors allow the heart to respond to adrenaline. So it lets the heart pick up heart rate and pick up contractility. In other words, it allows the heart to beat stronger. And so it allows the heart to function more physiologically. And then over time, we're able to perhaps remove these medications. But all of this has to happen in the context of optimal nutrition, where the patient's body is biochemically optimized through the nutrition, and we minimize the medication they have to have, and therefore minimize medication side effects. So these are many of the things that we deal with. We've recently been affected with some patients. I've come across some patients who have had certain medications started for high blood pressure, and we found that these medications started with high blood pressure has caused some form of heart failure and kidney problems. And so we've had to remove these medications to allow the body to recover. So oftentimes we're left between a rock and a hard place when we're treating patients with heart failure or any other chronic illnesses with the multiple medications. So what I want to do is give you insight as to how the nutritional detox can come into play. Oftentimes we give stories, and I'm sure you hear stories from many doctors online who use this approach, from my colleagues, and we all like to talk about our success stories. Oh, patient X, went on a plant-based diet and the cholesterol went down and it got off all the medications and the taxes went down and everything's wonderful. What I do want to emphasize with this discussion is that, generally speaking, it's not always that simple. And many patients, especially the patients that we see, are very, very ill. So we have to use an integrative approach to then get them stabilized and help their condition improve using nutrition as a foundation, and then selectively using medications in a temporary fashion to then allow the cardiovascular system to improve and things to get better. I will be interviewing some patients and sharing some specific data with you, but I want to give you that overview and some of the things that we do, and give you some insight in terms of the approach that we take and how this approach helps individuals with heart failure and how it can help individuals with many other conditions. And we'll give you some specific cases in the coming days as we bring some of our patients on to the show and have them share their journeys. Before I leave you today, I do want to give you some updates on COVID. I don't watch the news every day. I get some of the information, updates and some of the information. And of course, we're seeing, at least I'm hearing that reports that most states, the numbers are going down. There may be a few blips here and there. But one interesting thing I heard on the news is that there's some new models coming out. And the entity that's responsible a rise in COVID deaths and cases. Now, I thought that was interesting, and so there was an interview on one of the news channels, and one thing the expert, one of the models expert, shared with the news anchor person is one of the reasons that the models of the numbers are increasing in the models is that he says, well, one reason is that the way they diagnose COVID cases will not be based on positive testing, but it will be based on a presumption of COVID infection, simply based on either symptoms or whether the doctor just simply thought the patient had COVID. I thought that was quite interesting because, it can be problematic when you're making a diagnosis without definitive evidence. So, the symptoms of COVID are, fever, headache, congestion, cough, and the like. But that's the fever for the common cold, influenza. Some people have allergies, have cough and congestion and the like. Or many conditions have these symptoms. So the symptoms are non-specific. So when you have an individual who have, say cough and cold or whatever, and they happen to have a heart attack, but then they say, well, they had a cough and a cold and they had a heart attack and they died from the heart attack, we're going to call it COVID. The problem with that is that we've known for a long time that individuals with an infection of any kind, the infection can predispose to a heart attack. So for instance, if you have a tooth infection, the tooth infection itself brings about inflammation, and that inflammation anywhere can bring about inflammation everywhere. And so if they have in the arteries of the heart, if they have a little plaque that we call vulnerable plaque, meaning that the plaque doesn't have a very thick coating on top of it, and that plaque becomes inflamed, it's almost like having a pimple. If you've ever seen young people, I had acne when I was young, you have these little pimples that you can see the little pus, and there's a little thin skin, and if you just kind of squeeze the little side, it'll pop. Well, you can have similar things inside the coronary arteries. But if that thing capsule in the coronary artery pops, we call it a vulnerable plaque. If it pops, it creates an enzymatic cascade that forms a clot there, within seconds to minutes. And so that's how heart attack is formed. So if someone has a toothache or a cold or influenza or COVID or whatever kind of infection, that can cause inflammation throughout the whole body, including inside the heart, and that can trigger a heart attack. We know that's part of the mechanism of many heart attacks, not necessarily all of them. So for someone to have an infection of some type and die from a heart attack, you say, well, they died from the infection. It's not typically the way we classify diseases, because that infection could be from a toothache. You have a small subclinical tooth infection. People can have bacteria transverse the GI tract and get bacteremia and cause a little infection there and triggers inflammation. So there are a lot of triggers to inflammation that can then cause a heart attack and have the patient come to a heart attack. A patient with coronary disease with an unstable plaque who has a heart attack, well, they died from a heart attack. And so there are many things that can trigger that. So I thought that was quite interesting that, many of the COVID deaths are based on presumption and not requiring a diagnosis based on a COVID test being positive. And when you look at the CDC criteria, it says that, it doesn't require a positive COVID test to give the diagnosis of COVID-19. So I thought that was quite interesting. And the fact that some of the models are showing increased number of deaths is based on the fact that there's a presumption of COVID infection, not a definitive finding of COVID infection. And that can lead to some inflating of the numbers. I'm not trying to imply anything wrong. I try to stay neutral on this, and I try to present the facts as I see them. But it is a bit peculiar, and it does underscore, the numbers that we're seeing from COVID infection. So I'll have more on this coming in the coming few days. Sorry, I've been away from you guys for some time. However, it's been very busy in the office. Last note, I want to let you know, please reach out to your physicians about getting the COVID antibody test. Two of the labs that we use in our office are offering the COVID-19 antibody test. It is important to know whether or not you're antibody positive or not. If you are antibody positive, IgG antibody positive, that's important because it means you've been exposed to it and that you have some level of immunity. Many labs are not necessarily doing titers, but it does tell whether you have antibodies, and that's a good thing to know. So reach out to your physicians to learn about whether or not they have offering the test. We do offer it. Those of you can find us online at montgomeryheart.com. Feel free to call our office at 713-599-1144 to get more information. But many other offices and labs are offering the COVID antibody testing, and I think it's important to take advantage of that, especially if you've had a questionable exposure or any kind of fever, congestion, etc. It'd be good to know if you have it, because if you have the antibodies, that, in my opinion, is good news to you, and it's something you should find out about. So I'll have more information on that, the testing, but we are doing testing as we speak. Until next time, wish you the best. Continue to nourish your body as though it's your only body, because it is, and we'll continue to try to help you learn how to do that. Thank you very much.